And we continue with Dr. Raul Mendoza from Aurora Healthcare. Doctor, you were mentioning earlier about the wearing of face masks. I see people all over town wearing face masks, whether they are in a grocery store or whether they are out by themselves going for a walk. And I think a lot of these people don't know why they're wearing that mask. What's the real purpose of wearing one?
Yeah, well, the real purpose is if you are an asymptomatic carrier of the virus or any other respiratory virus, for that matter, by wearing the mask, you will decrease substantially the potential spraying of your own secretions to other people and infect them. So it's not to protect ourselves, it's to protect others from us. And there was no clear recommendation, but now they have done studies, serious studies at University of Hong Kong epidemiology team. They did a study that show clearly that the spraying of secretions during coughing or sneezing for infected people decreases substantially, and the shedding of viruses, because there's a physical barrier, decreases substantially in a room, close to zero. Of course, if you touch that by repositioning the mask, you can still contaminate other areas, but at least in a room or within certain distance, you decrease. So that's the reason. So to protect others, and if everyone wears a mask, everyone is protected. So I encourage people now when they go outside, if they're going to go to grocery shopping or to the pharmacy or to the gas station, wear a mask, protect others.
When people do wear the mask, do we run the risk of gaining a false sense of security and forgetting to keep that distance between each other?
Yes. We healthcare workers, we have to be trained and reminded of how to properly use a mask. So the mask is never a substitute for hand washing, use of the alcohol gel, and practice good basic hygiene and the same physical distance. Is the combination of everything what works. But also in healthcare settings, we have some training about different masks. By the way, a simple cloth mask, which is what I'm wearing right now when I go outside my office, a simple cloth mask is all is needed. You don't need an N95 mask because those are for healthcare. And if you look for those and then you use them, you are prevented from my colleagues, my coworkers, to be safe in a real COVID situation. So do not go and buy N95. They are not helpful to you if you don't know how to use them. A simple cloth mask will help.
All right, a couple of quick questions to run past you. Disposable gloves, good idea or not?
Disposable gloves, again, it can give you a false, wear them in situations where you know that you're going to be exposed to potential dry secretions or contamination. It is good practice, but always when we are in healthcare setting, before and after the gloves, and once we dispose the gloves, we go again for alcohol or hand washing. So it's not a substitute. It's okay to wear gloves if you want them. And if you go to the gas station and then you don't want to touch that's okay. But it is not a substitute for hand washing.
How effective, in your estimation, is hand sanitizer?
They are effective as long as they have X amount of alcohol. I believe 70% of alcohol. So sanitizer is good as long as you rub it well between your fingers and for an extended period of time. But 20-second hand washing is equally good and cheap. So don't, if you're at home, frequent hand washing, and if you have access to a faucet, 20 seconds of hand washing will do equally good as any sanitizer.
How much of a risk do we run by touching a doorknob, a door handle, a bathroom door, a countertop? What risk do we run there?
Well, it depends. Yeah, there's risk, but it's not the risk to the point that we need to be paranoid. Um, I was reading recently an epidemiologist that say that everything requires the perfect storm. It requires that somebody had sneeze in his or her hand and then touch the doorknob, and then those secretions endure, I don't know, 10, 15 minutes, because in 4, 5, 6 hours, probably those secretions will be dried out and the virus will die. And then you touch specifically that hand knob and then touching your face. So it's possible, but I don't want, again, I don't want for the people to be extremely paranoid. I want for us to be mindful and aware of our surroundings. And if you don't have other choice but to touch the hand knob, don't panic. Just don't touch your face. And the minute that you can, go and hand wash again, because you know that you touch a dirty surface. And we do that.
We have much more to come with Dr. Raul Mendoza right after this. Stay with us.